Did you know your feet can tell a lot about your health? Yes, indeed. Our feet, often overlooked, are like a mirror reflecting our overall health. Just as a mechanic can predict the problem with your car by hearing the sound it makes, doctors can tell a lot about your health by examining your feet. A wide range of health conditions manifest themselves through foot-related symptoms. Cold toes, for instance, could indicate poor blood flow or nerve damage from diabetes. Aching feet might signal stress fractures or arthritis. Even something as simple as a change in the color of your toes could be a sign of a severe health condition like Raynaud's disease. But it doesn't stop there. Issues ranging from heel pain to foot dragging, swollen feet to a burning sensation, all hold clues to your health. Unhealed foot sores, sudden pain in the big toe joint, even changes in the skin or nails of your feet can be telling signs of underlying health problems. So the next time you slip on your socks or shoes, take a moment to check on your feet. They might be trying to tell you something important. So pay attention to your feet. They might be trying to tell you something important. Ever found yourself with unbearably cold toes or aching feet? It's an uncomfortable feeling, isn't it? But did you know that these are not just simple annoyances? They could be signs of underlying health issues that need your attention. Let's start with those frosty toes. You might just think it's a chilly day, but cold toes can actually be a symptom of poor blood flow or circulatory problems. It could be due to conditions like diabetes, hypothyroidism, or even anemia. If you're consistently finding your toes feeling like ice cubes, it's worth considering these potential causes and seeking advice from a medical professional. Now let's shift focus to those aching feet. After a long day, it's normal to feel a little foot fatigue. However, if you notice a persistent, nagging ache, it's time to pay attention. This could be due to stress fractures, osteoporosis, arthritis, or even something as simple as poorly fitting shoes. Yes, your fashionable yet tight shoes might be the culprit. Intense exercise can also leave your feet throbbing, so it's important to ensure you're not overdoing it and giving your feet the rest they need. Cold toes and aching feet are more than just discomforts. They're your body's way of signaling that something might be amiss. However, don't panic. Many of these causes can be managed with lifestyle changes, medication, or the right pair of shoes. But remember, persistent cold toes and aching feet warrant a visit to your doctor. It's always best to seek professional advice when it comes to your health. Your feet carry you through life, so take care of them and they'll take care of you. Heel pain and foot dragging can be more than just discomforts. They can be indicative of underlying health issues that need your attention. Let's delve a little deeper into these conditions. Heel pain, for instance, isn't as simple as it sounds. It could be a symptom of various conditions such as plantar fasciitis, a common cause of heel pain, where the thick band of tissue that runs across the bottom of your foot and connects your heel bone to your toes gets inflamed. It could also be caused by arthritis, a condition causing inflammation and stiffness in the joints. However, heel pain isn't always due to inflammation. It could also be a sign of bone spurs, abnormal growths of bone on the underside of the heel bone. Infections, tumors, or fractures can also result in heel pain. It's crucial to pay attention to persistent heel pain to prevent these conditions from progressing. Now let's talk about foot dragging. This is when you have difficulty lifting the front part of your foot, causing it to drag along the ground when you walk. This may not sound serious, but it's often a sign of underlying issues. Foot dragging could be caused by peripheral nerve damage, which often results from conditions like diabetes or infections. It could also be a sign of vitamin deficiency or alcoholism. In some cases, it may even indicate problems with the brain or spinal cord, or issues with the muscles. The causes of foot dragging are diverse, and many are serious. It's not something to be ignored or brushed off as a minor inconvenience. Like heel pain, foot dragging requires medical attention. So remember, if you're experiencing persistent heel pain or foot dragging, it's important to seek medical advice. Don't dismiss these signs as mere discomforts. Your feet are integral to your overall health, and they deserve the same care and attention as any other part of your body. Swelling and burning in the feet are not normal. They could be signs of a health issue. Swollen feet are not a condition to take lightly. They can be an indication of various health problems, from poor circulation to issues with the lymphatic system. When your feet swell, it could be a sign that your body is struggling to pump blood effectively, leading to a buildup of fluid in the lower extremities. This can be due to heart disease, kidney disorders, or even a condition known as lymphedema, where the body's lymphatic system is unable to properly drain lymph fluid. In some instances, swollen feet can also be a symptom of an underactive thyroid. When the thyroid gland isn't producing enough hormones, it can cause a range of symptoms, including fatigue, weight gain, and yes, swelling in the feet. Now, let's switch gears and talk about that burning sensation in your feet. Similar to swelling, a burning sensation can be a red flag for various health issues. Most commonly, it's associated with diabetes. High blood sugar levels can lead to nerve damage in the feet, resulting in a tingling or burning sensation. But diabetes isn't the only possible cause. A deficiency in vitamin B can also lead to a burning sensation, as this vitamin plays a crucial role in nerve function. Other potential culprits include athlete's foot, a common fungal infection, kidney disease, which can cause a buildup of toxins in the blood, and poor circulation, which can lead to discomfort and a burning sensation in the feet. Finally, an underactive thyroid can also cause a burning sensation in the feet. Much like with swelling, this is due to the body's inability to produce enough thyroid hormones, leading to a range of symptoms including burning feet. If you're experiencing swollen feet or a burning sensation, it might be time to see a doctor. It's always better to be safe than sorry when it comes to your health. If you're experiencing these symptoms, it's crucial to seek medical advice, as they could be indicative of underlying health issues that require treatment. Foot sores and sudden pain in the big toe joint can be alarm bells for your health. Foot sores, those stubborn wounds that refuse to heal, can be more than just an annoyance. They are often a major warning sign for diabetes. But why is that? The answer lies in two major complications of diabetes: impaired sensation and poor circulation. Impaired sensation or neuropathy occurs when elevated blood sugar levels damage the nerves in your feet. This damage can lead to numbness, making it easy to overlook or ignore injuries to the foot. Poor circulation, on the other hand, means that less blood reaches the feet. Blood carries essential nutrients and oxygen, and without sufficient supply, it becomes difficult for sores or cuts to heal. Now let's talk about that sudden, sharp pain in your big toe joint. This could be a sign of gout, a type of arthritis caused by excess uric acid in the bloodstream. The uric acid can form needle-like crystals in a joint and cause sudden, severe episodes of pain. Osteoarthritis, a common form of arthritis, can also cause pain in the big toe joint. It happens when the protective cartilage that cushions the ends of your bones wears down over time. Another possible cause is a bone spur, a bony projection that develops along the edges of bones, often in response to pressure, rubbing, or stress that continues over a long period of time. And let's not forget turf toe, a sprain of the big toe joint resulting from injury during sports activities. Don't disregard foot sores and sudden big toe joint pain. They could be signs of a serious health problem. Itchy, scaly skin and claw-toe deformity on your feet are symptoms you should never ignore. Let's dive into the causes of these symptoms. Itchy, scaly skin on the feet can be a nuisance, but it might be indicative of something more severe. It could be a simple case of athlete's foot or contact dermatitis, both of which can be treated with over-the-counter medications. However, it can also be a sign of psoriasis, a chronic skin disease that speeds up the life cycle of skin cells, causing them to build up rapidly on the surface of the skin. It's not just an aesthetic issue, it's a sign that your skin's natural balance is off, and it could be affecting your overall health. Now, let's transition to the topic of claw-toe deformity. This condition is characterized by an abnormal bending of the toe, giving it a claw-like appearance. The causes can range from wearing tight shoes, which compress the toes, to nerve damage from diabetes or other neurological disorders. This can lead to pain and discomfort, making it difficult for individuals to walk or wear shoes comfortably. In severe cases, it may even require surgical intervention. The crucial thing to remember here is that these symptoms are not just cosmetic issues. They're signals from your body that something may be off balance. Ignoring these symptoms or brushing them off as mere aesthetic inconveniences may lead to further complications down the line. It's essential to seek medical advice if you're experiencing these symptoms, as early intervention can prevent more serious issues. Your feet are an often overlooked part of your body, but they're a key indicator of your overall health. They're like a window into your body, giving you clues about potential health problems that may not yet have other symptoms. So don't ignore these signs. Pay attention to your feet. They might be trying to tell you something important. Remember, itchy, scaly skin and clawed toe deformity are not just cosmetic issues. They could be indicating a serious health condition. The health of your feet is a window into your overall health. As we've explored throughout this discussion, your feet can signal a myriad of health issues, from circulatory problems and nerve damage to vitamin deficiencies and systemic diseases. Cold toes, aching feet, heel pain, foot dragging, these are not just discomforts to be dismissed. They are valuable indicators telling us stories about what might be happening in our bodies. The same is true for swollen feet, burning sensations, unhealing foot sores, or sudden pain in the big toe joint. These symptoms, however subtle, could be sounding the alarm for conditions like diabetes, heart disease, or arthritis. Even changes in skin condition or nail appearance on our feet can be telling signs of health issues. Therefore, it's essential that we pay attention to our foot health, not just for the sake of our feet, but for our overall well-being. If you notice any unusual symptoms, don't hesitate to seek medical advice. Early detection and intervention can make a world of difference in managing and treating potential health issues. So next time you think about your health, remember to include your feet. They could be telling you more than you think.